Prior to beginning, we wish to acknowledge that we are on the territorial homeland of the many diverse First Nation, Métis, and Inuit people whose ancestors have walked these lands before us and those whom we share this great land with today. My name is Kaylin Boileau, and I'm the president of the Canadian Pressure Injury Advisory Panel. I'm a registered dietitian, and when not on maternity leave, I'm the corporate wound care lead at Toronto Grace Health Centre. My passion for pressure injuries stemmed from my graduate training when I realized there was a big disconnect between pressure injury prevention and care knowledge around nutrition from the clinician perspective. Several years later, I continue to devote my career to pressure injury prevention and care, and I've really seen the impact that optimal nutrition care can make. Josh and I will be your moderators for today, so I'm going to pass it over to Josh to introduce himself.
Thanks, Kaylin. Good morning, everyone. So my name is Joshua Marleo, and I'm the current president-elect of the Canadian Pressure Injury Advisory Panel, also known as CPIAP, which is a national body of experts in pressure injury prevention and management who have come together to make a change on a nation under pressure. Presently, I practice as a clinical nurse specialist, and also I am a certified nurse specialized in wound, ostomy, and continence. Preventing and managing pressure injuries has been a passion of mine, which stems from the beginning of my nursing career, as these were the first type of challenging wounds that I have encountered in my practice. Not only have I been exposed to the complexity of its prevention and management, but I have seen firsthand and continue to witness the detrimental impact of these long-standing wounds on the quality of life of those affected persons, including the psychosocial impact it delays to their families and caregivers. Fast forward 15 years, I'm actually thrilled that we are here to discuss how we can best address the prevention and management of pressure injuries as a nationwide concern. Kaylin.
Pressure injuries continue to be a concern in Canada and happen throughout the continuum of care and in every province and territory. Unfortunately, there exists little Canadian data on the extent of this problem. The last nationwide survey that we have looked at the extent of pressure injuries from a prevalence perspective from 1990 to 2003 and found that 26% of patients across all institutions studied had pressure injuries. In Ontario, from 2014 to 2015, we saw 60 in 100,000 patients hospitalized for the treatment of pressure injuries. Further research is really needed in order to better understand the impact of pressure injuries across the continuum of care. In order to address this problem in Canada, we in 2021, the Canadian Pressure Injury Advisory Panel was formed, bringing together an interprofessional nationwide panel as an interest group of nurses specialized in wounds, ostomy, and continence Canada. This pan-Canadian panel serves as a national advisory role and is represented by a cross-section of health professionals and researchers from different healthcare sectors, from acute care to community and everywhere in between. Through organized work streams, CPIAP continues making pressure injuries a national priority. We drive standardization, we advocate for policy solutions, and optimize knowledge translation. Driven by our strategic plan, we have been busy this last year working on several initiatives. Most recently, we have been advising on local and international guidelines, including the International Prevention and Treatment of Pressure Injury Ulcers, the Clinical Practice Guidelines, and the RNAO Best Practice Guidelines, Pressure Injury Management, Risk Assessment, Prevention, and Treatment, which we're very excited will be coming out later this week. Our work streams have been conducting in-depth nationwide environmental scans to compile current pressure injury prevention guidelines, policies, and procedures, as well as client education resources across the continuum of care. Some of its data is being used in a white paper that we're currently working on to define the scope of pressure injuries in Canada. We are excited to be able to share this data with you once we have finished compiling it. CPAP is committed to a Canada united in pressure injury prevention, management, and policy. While advising on these best practices and analyzing current policies across Canada, we identified the need to engage decision makers, from policymakers to administrators, in order to gain commitment to support evidence-informed patient safety in pressure injury prevention and treatment from a national lens across the continuum of care. And really, that's why we're all here today. So with that, I'm going to pass you over to Josh to review goals and expectations for today.
So on behalf of the CPIAP, we would like to extend our warm welcome and gratitude for taking a time out of your busy schedule for being with us either in person or online for this important event. Today marks the first ever Pressure Injury Summit, and we have about 400 attendees from across Canada, which shows a great deal of interest, enthusiasm, and proactiveness towards addressing pressure injuries across our Canadian nation. As what you may have seen in our planned agenda, we are delighted to be led by our esteemed set of speakers, clinicians, and healthcare leaders who will take us on a journey that highlights the current gaps and existing concerns that makes pressure injury prevention and management a challenge. We will also be humbled to hear from a person with lived experience with a pressure injury to inform, educate, and inspire us with her story. At the end of the day, we will have an opportunity to discuss the identified challenges and collaboratively explore potential strategies to improve our initiatives. Proceedings of this meeting will be recorded by Mr. John Gregory of Open City, and everyone who has registered for today's CPIAP Summit will receive a copy of the meeting proceedings on the week of December 9th, 16th. In terms of housekeeping, we will have 2 planned coffee breaks, one mid-morning and another mid-afternoon, just after the last talk of the day. And lunch will also be served at noontime. Now, there are 2 sets of washrooms that are located just outside the auditorium. And if you exit through the main door, one is located just straight ahead past the elevators to the left. And also one is just around the corner, adjacent or next to the set of stairs. I would also like to extend our warm welcome and thanks to our industry partners and exhibitors who are here today, who made this day possible with their support, whom you also have an opportunity to engage throughout the day. And last, but definitely not the least, I would like to give a special shout out to the University Health Network, especially Toronto Rehab Institute, for hosting us this morning, who collectively share the same vision and values towards pressure injury prevention and management as the CPIAP. Today, Canada is united in advocating for meaningful change in pressure injury prevention and management. I do look forward to collaborating and learning from and with each and every one of you as we delve into today's current crucial conversations. Thank you. Now I would like to take a moment to introduce Pam Ubley, who will be providing us with the opening remarks. Pam Ubley is the Vice President of Health Disciplines and Chief Nurse Executive at Canada's #1 hospital, University Health Network. She is an experienced executive known for her commitment to excellence in person and family-centered care, collaborative partnerships, and authentic presence. Throughout her career, she has been a trailblazer and changemaker, providing strength-based, solution-oriented leadership for over 3 decades. She's a fellow in the Canadian Academy of Nursing, Canada's highest level of recognition for nursing leadership, a fellow of the J&J Wharton Nurse Executive Program to the University of Pennsylvania, and a graduate of the Rothman Advanced Health Leaders Program at the University of Toronto. She is a member of the Wilson Center and the Institute of Education and Research at the University Health Network. Pam holds an adjunct faculty appointment, almost there, at the Lawrence Bloomberg Faculty of Nursing at University of Toronto, and is well known for her contributions to new models of care, the promotion of healthy, safe work environments, and capacity building innovations locally and around the globe. Now a warm welcome to Pam Ubley.
Thank you. Okay, wow. Thank you, Josh. That was wonderful. And what a great day to be here and to see so many people from a variety of professions, see our vendors, see people who are here because this is such an important priority for you in your work, in your leadership, in your commitment to patients and families, and to your professional goals. So you wouldn't be here if this wasn't something that was really, really important and close to your heart. So thank you for being here. As Josh said, I am UHN's Chief Nurse Executive and one of the Vice Presidents of Health Disciplines. And I'm really very, very pleased to welcome all of you here today. And it's such a pleasure for UHN to be hosting this very first Canadian Pressure Injury Summit. This really is a milestone event. We are delighted that we will be able to share together, we will learn, we will be in a space where we're really trying to raise the bar, not only in our own local environments, but nationally across the entire country. I think that's absolutely fantastic. I do know there's a tremendous amount of work that goes into planning for such a day like this. So thank you so much to the organizing group for making this important day for learning and discussions and insights possible. Of course, I do want to do a shout out to our very own Josh, our team UHN nursing colleague. Josh Moriano is playing such an important role advancing the important work of the Canadian Pressure Injury Advisory Panel as their president-elect. So Josh, you know, we've got your back, and anything we can do at UHN to help you in this important work and to ensure that we are raising the bar ourselves in all of the preventative strategies and all of the care and treatment required for any individual who has to suffer. And I will say suffer. I know that pressure injury is so impactful to so many parts of an individual's life. So anything we can do to prevent pressure injuries is something we should do. Josh, you really not only are providing excellent leadership with this group, you do provide good and important support here at home to all of our team members as a clinical nurse specialist in wound and ostomy care at our Toronto Rehab Institute, and in particular at the Bickle site. So I know you have many colleagues who might be here in the room and also online giving you a great shout out. Today, with the recent addition of the West Park Healthcare Center into the UHN family, UHN is proud to lead the largest complex rehab center in the country. This is part of our broader continuum of care in treating the most complex patients across Canada. As a result, we are very, very much invested in the importance of pressure injury prevention, management, and education. And today's conversation, where industry experts will go deep to explore ways we can strengthen prevention and management in all of our healthcare settings. Here at UHN, our wound care clinical leadership team plays a central role in wound care education and treatment across our organization, both for our healthcare teams as well as for patients and their caregivers. We know education with patients and caregivers is one of the most important means to preventing the development of pressure injuries. Our interdisciplinary skin health steering committee is another way that UHN has provided experts like Josh the opportunity to collaborate on clinical care, research, education, strategic leadership, and decision-making around skin health and other clinical nurse specialists, with our physiotherapists, occupational therapists, dietitians, and patient partners. It really does take a team to do the best work to prevent these injuries. We're also harnessing technology tools like Epic to improve timely pressure injury documentation and to have better data to guide our decision-making. It's a continuous focus on pressure prevention at all levels. We also use our daily unit huddle structure to ensure that we have a review of patients with existing pressure injuries, patients that are at risk for developing these injuries, and any opportunity to discuss care plans in place for each of these patients. I think that's such an important opportunity every day our point of care staff have to come together and really identify the patients who need them most. And finally, we are focusing on quality improvement, comprehensively measuring, analyzing, tracking, and reporting on pressure injury data, including through our corporate quality and safety report card and our safety event reporting tools. All of these are efforts that we are making and that we started many years ago to make pressure injuries an important patient safety issue here at UHN. Today's conversation provides another seminal opportunity to discuss ways we can continue to strengthen this work across our health system. I know from my own experience as a nurse, pressure injuries can be devastating for patients. They really interrupt the daily activities, the opportunities to engage in life to its fullest, and they can be so difficult, not only to manage once they've happened, but to overcome. We know it takes the entire team. Our dietitian who was up here earlier, I mean, oh my gosh, I remember as a nurse, I learned so much about the importance of wound healing from my dietitian colleagues. I learned so much about the importance of pressure points, and whether it was splints or wheelchairs or other opportunities that are we needed to pay more attention to, because patients needed to be protected from these pressure injuries. It was so important to really listen to each other, to have the whole team come together to talk about the best way to care for patients. And of course, the nursing care that was required on a daily basis to prevent by turning patients, by attending to skin care, by really paying attention to the needs of the individual patient. And then, of course, if there was an injury, to help support the wound healing. So important, our point of care nurses across all of our institutions. Thank you for everything that you do. I'm really excited that today is going to be first. It's going to be a wonderful opportunity, not only for learning, but for plotting the future, for thinking about what comes next and what else we can be doing as healthcare professionals, as healthcare institutions, and as a nation to keep people safe and prevent these terrible injuries. So for now, I want to say thank you for being here. I know we've got a full agenda. There are other exciting speakers, new information that will come to you, new opportunities you'll get insights into research. And I just hope it's an absolutely wonderful day for everyone. Thank you so much for being here at University Health Network.